Today, I just want to talk to you about the viral fever. In the summers, we see children suffering with a lot of viral fever, which can go very high. Now, sometimes we have to put those children inside the ICU. Now, which are the children with the viral fever who require to be admitted in ICU? Now, remember, ICU is not a place where we are doing a lot of treatment for the child. Sometimes, just because we require little bit more monitoring for the child, we require these children to be in the ICU. So the children who are very dehydrated, who require a lot of fluids, who have lost a lot of fluid from their body, like in vomiting and loose motions or not eating well. Now, those are the children we require to give them the fluids as in the form of intravenous fluids. So this fluid correction that we are doing for the children who are very dehydrated, they require to be in the ICU. Now, the certain children who's because of the dehydration, because of the fever, their blood pressure can vary. It can go a little down, and these are the children who require to be monitored inside the ICU. If the children is having a breathing difficulty, he requires oxygen, or the child is having wheezing, a very bad cough. Now, these are the children who require to be in the ICU to monitor their oxygen saturations. So, these are the children who are having a fever and they require a little bit more of monitoring. The other sector of the children are the one who are very sick. A child who is very dehydrated, his blood pressure is falling down, a child who's having an infection inside the lungs, he's breathing fast, he requires oxygen or anything else apart from oxygen, like a ventilator, require a recurrent nebulizations. Children who are not passing enough urine, they are having an effect on their kidney or liver because of the viral infections. These are the children who require to be in ICU. What do we do in ICU? We treat the child with IV fluids. We try to give the corrective managements. We try to correct whatever is wrong in their body, like in form of electrolytes, in form of antibiotics, in form of giving oxygen or other oxygen delivery devices, and also taking care of their blood pressure, giving the medicines which require the blood pressure to come back to normal. And once this viral infection has come down, the multiple organs which have been affected because of this viral fever, they become better. The child hemodynamics, that is the blood pressure, heart rate, everything is settled down. His oxygen level is settled down. These are the children who are being shifted out of the ICU. So ICU is a place where we admit your child because we want to monitor the child a little bit more closely, give him the treatment, and make sure the child becomes all right faster. And that is why we require the ICU. So my advice to the parents will be, don't panic in case if your doctor tells you that we are admitting the child in ICU. Sometimes it is just for the monitoring purpose, and as soon as the child becomes all right, we shift the child from ICU to the normal wards or the normal rooms. So ICU is a place to keep your child safe and make sure that your child becomes all right faster. Thank you.